Good evening. We will continue again talking about how to take a history for peripheral vascular disease or peripheral arterial disease case. We have discussed in the previous videos how to take history, personal history, and how to analyze the main symptoms, which are the intermittent claudication, wrist pain, or tissue loss and gangrene. We will continue talking about the present illness today. We have to understand that the atherosclerotic process and the degenerative process in the vessels might cause stenosis or occlusion in the vessels, and this would cause peripheral arterial disease. On the other hand, we have to remember that the degenerative process of atherosclerosis doesn't only cause stenosis and occlusion, it can cause weakness in the wall of the artery. And if the artery reaches 1.5 times of its normal size, it will be called an aneurysm. So aneurysm is a very important topic to ask about it in the present illness and in family history in patients with suspected peripheral vascular disease. There are different types of aneurysms, but we are talking about degenerative aneurysms that mostly affect the aorta and the popliteal arteries. We have to ask the patient if he had a previous amputation, either minor amputation in the form of a toe or transmetatarsal amputation, or a major amputation in the form of below knee or above knee amputation, and what was the cause for this amputation and when was that. Most of amputations actually happen because of infection in diabetic patients, but still there are some cases who would have amputation just because of peripheral vascular disease. We have to ask the patient as well about previous interventions that were done to treat peripheral vascular disease, either in the form of angioplasty, bypass, or endarterectomy, either in the same side, on the ipsilateral side, or on the contralateral side. As regards past medical history, we have included all the other diseases that are risk factors for peripheral vascular disease or other beds affected by atherosclerosis in the present illness. If you didn't include them in the present illness, you have to ask about these risk factors and other beds affected by atherosclerosis in the past medical history. Then you have to ask the patient about other medical diseases that he might suffer from and what medication he is taking for them and for how long, and if there is any accompanying complication. Then you will ask the patient about the past surgical history, if the patient has any allergy, and if the patient had a previous blood transfusion and the cause for that. After finishing the past history, then you'll ask the patient about social history. And again, smoking is very, very important. I'd prefer that you will include it in the present illness rather than in the social history. But if you didn't do so, you have to stress about the presence or the absence of smoking in the social history of the patient as the first item to be discussed. Then you'll ask the patient about alcohol intake and intravenous drug use. Usually alcohol doesn't have a direct impact on peripheral vascular disease. IV drug use could cause some troubles in the artery, especially causing pseudoaneurysms and thrombosis, and sometimes trash hand and feet with injections. It doesn't cause peripheral vascular disease acutely, but it can lead to peripheral vascular disease if the patient had a pseudoaneurysm that was treated only with ligation of an artery, and then the sequelae of this patient will be peripheral vascular disease. As regards family history, we have to ask the patient about family history of similar condition in the form of peripheral vascular disease, and if any of the parents had a previous amputation or aneurysms. We have to ask as well about risk factors, including diabetes, hypertension, and other beds affected by atherosclerosis in the family, like ischemic heart disease and cerebrovascular accident. This is all what we have about history taking in peripheral vascular disease or peripheral arterial disease cases. In the following videos, we will go through the examination of arterial system in patients to be able to diagnose peripheral arterial disease or acute arterial injury or occlusion. Thank you very much. I'm waiting for your comments and questions below the videos, and I will try as soon as possible to answer them either in new videos or in the comments. Thank you.